just a little fact, 40 years ago, Alzheimer's Arkansas started off as a volunteer support group. To date, we have 5 paid staff. We service over 62 of the 75 counties. We have given away hundreds of thousands of dollars. And last year alone, we had over 25,000 caregiver touches. Grants, phone calls, workshops. So thank you for allowing us to be on your journey.
But dementia is not really a disease. Dementia is the clinical syndrome. Dementia means that there is a decline in memory and thinking that reaches the point that it interferes with function. That's all dementia means. It's a clinical syndrome. So it's not a specific disease. Alzheimer's disease is a specific disease. It is the one that causes most cases of dementia. But it's not the only thing that causes dementia. There are diseases like dementia with Lewy bodies. There's behavioral variant frontotemporal dementia. There's vascular dementia. But dementia is not a disease, it's a syndrome. So the old criteria for Alzheimer's disease say that to be diagnosed with Alzheimer's disease, people have to actually have dementia. The dementia has a slow or insidious onset. You know, it's hard to pin down when it started. People say, well, now that they've made the diagnosis, I think actually Dad was having problems years before that. You know, or you go back and it's hard to pin it down. There's evidence of progression. That goes with the diagnosis. And the neurological exam is usually normal except for mentation or except for memory and thinking. We also would make sure there's not some other condition causing it. And it's important to note that Alzheimer's disease should not be diagnosed when medications are in use that cause cognitive impairment. So in other words, if people are taking narcotics or sedatives or drugs like that, we cannot properly diagnose Alzheimer's disease. And I see at least one person a week who was diagnosed with Alzheimer's disease while they were on some heavy-duty pain medicines, for example, and that was inappropriate. And sometimes when we take them off the medicine, their dementia goes away. There are multiple different presentations of Alzheimer's disease. The most typical one is the amnestic presentation, and that's the one where memory loss is early and predominant. So the major symptom in the amnestic presentation of Alzheimer's disease is memory loss. But there are some atypical presentations, including the language presentation, in which there is something called a logopenic aphasia. So sometimes people just have really severe trouble with language or trouble communicating, not really memory loss as much as they just can't think of words. You know, and people start to talk in a funny way that we call circumstantial speech. So they can't think of words, so they just talk around them. So when they're talking about going to the drugstore, they talk about going to that place where you go to get your medicine. They also, with a logopenic aphasia, they have a particular problem repeating longer sentences, but they can repeat short sentences and words okay, and they know what things are. They have what we say preserved object knowledge. So they may not be able to say this is an ink pen, but they know what it is, and they know that it's a thing used to write. And so that's the logopenic aphasia. And some people start off with that language presentation, and that is the main symptom for quite a while for some people. There's also a visual spatial presentation, which has been termed posterior cortical atrophy in many cases. And that's where people start off just having trouble with their vision. But they go to the eye doctor, and the eye doctor says, you're fine. You don't need glasses, your eyes are fine. But they can't see the thing in front of them. You know, and you say, Mom, pick up your brush there. And she's like, I don't have a brush, where? And it's right in front of her, you know, and so that sort of symptom, when it is the only symptom and when it starts off with that, that's the visual spatial presentation of Alzheimer's disease. And there's an executive presentation, which is a very hard one to diagnose, in which people just have trouble following patterns or following recipes or following steps in a process. You know, they can't figure out how to do things. One patient I saw, I remember, who was actually fairly young at diagnosis, her initial symptom was she couldn't figure out how to use the door lock. She could remember things pretty well, but couldn't use the door lock, and it started extending to other things. She had apraxia. She was having trouble using tools of all kinds. And for a long time, that was the only symptom, and memory loss came along later. So these atypical presentations are presentations where the initial symptoms are not really memory, it's something else. But it may be due to Alzheimer's disease, and we know that it's a form of Alzheimer's disease where the pathology starts in a different part of the brain. Where it usually starts is the memory forming area, but sometimes it starts in other areas and you get these other symptoms. So that was recognized in the original criteria. But the diagnosis in these criteria was entirely clinical, and the diagnosis of Alzheimer's disease was only made when the clinical syndrome of dementia was present. Now, we knew that a lot of people have memory trouble before they develop dementia. Dementia doesn't develop overnight. So dementia, again, is when the memory trouble is bad enough to interfere with function. But they almost always go through a period of time where memory is pretty bad, but they can still function okay. And if we test them, their memory is really bad on testing. That has been codified for several years as another syndrome. So dementia is the syndrome where function's impaired. Mild cognitive impairment is a syndrome where they have really bad memory, but they still function okay. They can still manage their medicine, they can still pay their bills, do their grocery shopping, drive, do all that, but their memory's really bad. They say it's bad and they come to the office and they score really badly on a test. That's mild cognitive impairment. It's been recognized for years that most people with mild cognitive impairment have a really early stage of Alzheimer's disease. But we never used the diagnosis Alzheimer's disease until they developed full-blown dementia, because you had to have that clinical syndrome of dementia to get the diagnosis of Alzheimer's disease. Okay, so those were the old criteria. Now we're moving into a new age of diagnosing Alzheimer's disease, and the subcommittee on diagnosis from the Alzheimer's Association has already laid out some fundamental principles that they say are obvious, and we're now going to put these in practice. So one of those is it's necessary to separate the syndrome from the biology. So the clinical syndrome of dementia, that's separate from the biology of Alzheimer's disease. But I said that a minute ago, dementia is the syndrome and there are diseases that cause it, but we're now going to emphasize that more in the diagnosis. So Alzheimer's disease is now going to be recognized as the biological entity in which you get abnormal proteins deposited in the brain, beginning with amyloid and later including tau protein, 2 abnormal proteins in the brain. That's going to define the disease in the brain. So we know the amyloid is the first thing. After the amyloid accumulates for several years, it triggers hyperphosphorylation of tau protein. Now, beta amyloid is a piece of a normal protein, but the piece is abnormal. It's cut out abnormally. So beta amyloid is not a normal protein. Tau protein is a normal protein in the brain, but it gets hyperphosphorylated and becomes what we call phosphotau, and that's abnormal. And that chokes the cell and causes the cell to die. And so the amyloid triggers the formation of the tau. It appears that once it triggers it, the tau keeps going. That's self-perpetuating. So these two processes, that's how the disease begins. And these things start happening before somebody has any symptoms. The new criteria say that in living people, the disease of Alzheimer's disease will be diagnosed by the presence of specific biomarkers, what we will call core biomarkers. So these are things we can test for in the clinic, actually. Unimpaired individuals, so people who don't have any symptoms, who have abnormal biomarkers, are not said to be at risk of developing Alzheimer's disease because having the biomarker defines the disease. That means they already have it. But people who are not impaired, who have the abnormal biomarker, are at risk of developing symptoms due to Alzheimer's disease. So you see the shift. Now the Alzheimer's disease is diagnosed on the basis of the biology, not on the syndrome. There is no brain scan, there is no blood test that tells you somebody has dementia. I'm sorry, doctor, you've got to ask those questions. You've got to examine your patient.